Today, I want to talk about why we prescribe spinal cord stimulation, also known as neuromodulation. First off, who is this for? We typically recommend this treatment for patients that have one of the following. First, non-surgical low back pain. This is patients who have had back pain but are not a candidate for surgery. Second, failed back surgery syndrome. You've had back surgery, but you're still in pain. Third, complex regional pain syndrome. This is where you've had a knee or shoulder replacement or another surgery and pain persists in that area, or if you have had trauma to a limb and you still continue to have persistent nerve pain. Lastly, painful diabetic neuropathy, nerve pain in the hands or feet causing a burning or tingling sensation due to diabetes. I'd also like to mention there are also many other conditions we treat successfully with this therapy. All of these conditions have one thing in common. Nerves are damaged and inflamed, sending pain signals to the brain. How does spinal cord stimulation work? Think of this as a pacemaker for pain. Just like a pacemaker keeps your heart beating properly, this device helps regulate the nerves transmitting pain signals, reducing interference from inflamed nerves. This allows you to experience relief, become more active, and regain your quality of life. So why do we prescribe this for our patients? We recommend this because it works. 80% of patients experience at least 50% pain relief or better. In fact, on average, patients see 70 to 80% improvement in their symptoms. So, what does success mean when it comes to this procedure? Success means that if you try the device and experience at least 50% relief, we consider it effective. If you get less than 50% relief, we won't move forward with a permanent solution. So, what to expect? By this point in time, we probably ordered any necessary blood tests, imaging, or other evaluations to prepare you for the procedure. You'll have plenty of time to ask questions, and our team will be with you every step of the way. I understand this can be pretty overwhelming, but you're not alone. What are the next steps as you get ready? First is insurance approval. Once we gather everything, we submit it for authorization. Second is a test drive. You'll come to the surgery center for a temporary trial. Doing a technique similar to an epidural, we'll place a small electrode in your back. A small battery pack with a computer chip embedded in it is taped to your back for 5 to 7 days. If you experience significant relief, we'll discuss a permanent solution. If it doesn't work, we'll adjust the settings. If relief is still minimal, we won't proceed. So, why should you trust us? Something you may not know is that our team is recognized as a center of excellence for spinal cord stimulation. We are one of the few providers in Arizona that teach this therapy at a national level. Doctors from across the country train with us because of our expertise and success rates. Our patients experience some of the best results in the nation. Is this procedure safe? Every procedure has risks, but the risks are similar to an epidural steroid injection. If the trial doesn't work, the electrode is simply removed and a small bandage is placed over the area. That's it. The process is minimally invasive, low risk, and stress-free for you and your family. Our goal is to find the right solution for your pain and ensure this is the best option for you.